Good morning,
All right.
everyone. I'm Chris Wildman from the Elder Dental Program of the Community VNA. I'm the program coordinator. I'm here this morning with students from Regis College Dental Hygiene class and their instructor, Miss Jeannie Chambers. The students are going to do the first part of this presentation, and then I will speak a little bit at the end. So right now I'm going to turn it over to Miss Chambers.
Hi, we're happy to be here. And I just wanted to mention one little thing about the clinic here at Regis College. I know it's a little far from Attleboro, but who knows? We're located at 1432 Main Street in Waltham. And the phone number is 781-768-7250. And we provide low cost, very competent oral health procedures like cleaning your teeth and applying fluoride. So if you're in the area or you think you might be visiting family or something up here and you want to get some nice oral health care, just give us a call and they can make you an appointment. Okay, so I'll now leave it to Sabrina, who is going to be our first presenter. There you go. Okay.
Good morning, everyone. My name is Sabrina, and today me and my fellow classmates will be speaking to you about the importance of oral health. First, I'll be teaching you a few toothbrushing methods and how to floss. After that, Carolina will speak to you about the importance of fluoride and how to control dry mouth. Following that, Jessica will be talking about dentures and how to take care of them. And finally, Wilmy will be speaking about nutrition and what foods increase your risk to cavities. I'm just going to share my PowerPoint. So I'll be talking about toothbrushing methods, flossing, and any assistive devices to help with the brushing and the flossing. These are a few toothbrushing methods that I'll be talking about. So usually when you begin to brush your teeth, it's best to start in areas that are frequently missed or areas that are difficult to reach the toothbrush in the back of the mouth. And this will be easier on your hands for when your hands start to get tired brushing at the end. And it is recommended to brush 2 minutes twice a day. And I know it's hard to determine like how long you've been brushing. So sometimes some people will use like one of those sand timers or just a timer, which helps them determine how long they've been brushing for. So the first method of toothbrushing I will be talking about is the Bass or circular method. And this is the most effective and most frequently recommended one. This is for anyone that has healthy teeth and gums, or anyone that has diseases of the teeth and the mouth. So first, you're going to take your toothbrush and you're going to have the toothbrush angled up. So it's going to be angled towards the gums and the teeth, just like this. And when you move the toothbrush, you'll hold it like this. And it'll be angled towards the teeth like that. And you'll just move in small circular motions in that area. And you do this for all the surface of the teeth on the outside. And then when you get to the bottom of the teeth, you're going to take the toothbrush and you're going to angle it down towards the gums. And you're just going to move it in the small circular motions just like that. And when you when performing these brushing methods, you want to put light pressure on the teeth to not make the gums sensitive. The next method I'll be showing you is the Stoneman's method. This is for anyone who has recession or receding gum lines. This is like, if this means, recession means is like your gums basically shrink. And this one is similar to the method I just showed you, but it is more angled and more on the gums. So you're going to angle the toothbrush again, but instead of being more on the teeth, you want to be more on the gums like this. And you're gonna do the small circular motions again, just like that. And then the same thing for the bottom. Instead of being on the teeth when you angle down, you're gonna be more on the gums and do the small circular motions. And when you do the inner surfaces of the teeth right here, you're gonna use this part of the toothbrush, which is called the heel. And you're just gonna move just like that, back and forth. The third method I'll be showing you is the Charters method. This is good for anyone with like fixed prosthetics, and it will help keep them clean. So this one, you're gonna angle the toothbrush more down like this, and you're just gonna angle it down so it is the bristles of the toothbrush are facing away from the gums right here. And you're gonna just do small circular motions just like that. And then when you do the bottom teeth, you're gonna angle the toothbrush more up so it's away from the gums, just like that. And you do the small circular motions again. And again, try to use light pressure when brushing. Now I'll be showing you some assistive devices that will help make it easier on like your wrists, your hands, and your arms when brushing, because it can be tiring sometimes. And then sometimes some people have a hard time holding the toothbrush, so this will help with that also. So these are a few devices that go on the handle of the toothbrush, and it just makes it easier for the person to grip the toothbrush, and it gives it a range of motion. And then here is one more. This one right here just goes on the end of the toothbrush, and then this one goes around the whole handle of the toothbrush. And sometimes they have brushes that will have different handles that are angled different ways to make it easier. Another way to make brushing easier is to get an electric toothbrush, which can be found at, some may be expensive, but most are inexpensive and can be found at stores like CVS, Walgreens, and stores like that. And these make brushing easier because the handle is already big enough, which makes the grip easy. And then, as you can see in the picture here, it will be easier on the wrists also because the toothbrush is vibrating. So you won't have to do the brushing motion. You can just hold the toothbrush in the area for a few seconds and just go around the mouth just like that. Now I will be talking about different flossing aids because it can be difficult to floss and reach towards the back of the mouth. This right here is a floss holder, and you can use, you'll take like the string floss, and it will go around this, it will wrap around this part right here and go through the holder part right here. And as you can see right in this picture right here, it makes it easier to go in between the teeth, and because the handle is long, it will help reach towards the teeth in the back, which most people miss when flossing. Another device that can help with flossing is a water pick. This squirts water at the gums, and it will move any food or debris that are on the teeth and along the gum line. It will go between the spaces of the teeth also, and will reach the inside of the teeth. And right here is I'm just showing you what happens when you use the water pick. And that's it. And so if you have any questions, feel free to ask, and I can answer them now or at the end. And next we'll be speaking is Jessica.
All right. All right. So my name is Jessica, and I'll basically be going over denture care. So first we'll start off with what are dentures. So dentures are made to replace missing teeth. They're usually made up of acrylic, plastic materials, metals, for aesthetic purposes and mainly the weight. In the past, they did use porcelain teeth, but they don't really do that anymore because it just makes the denture a lot heavier. So as far as denture types, so on the upper left of this, well, the upper left of the screen is full dentures. So that's somebody that's completely a dentureless. In the middle, that's considered a partial denture. It does have, it's for somebody that's missing just a few teeth, or, you know, they have a few teeth missing on each side. So the metal pretty much connects the partial to help it maintain like stability. And to the right, that's considered like a flipper, somebody who's just like missing like one tooth, two teeth in the front usually. And it's just made to like replace that. So now we're going to talk about fit. So fit for the denture is really important. Your denture should fit like snug. It shouldn't be too tight or too loose. If you answered, you know, yes to my denture is too tight or yes, my denture is too loose, then you should follow up with your dentist just to at least get an adjustment if it's too tight, or some type of reline if it's too loose, because you don't want them like flopping around, or, you know, if they're too tight, they can cause sores in your mouth. And in order to relieve the sores, you need to get rid of the problem, which is like where the denture is rubbing. So now I'm going to go over different adhesive materials. So if your denture is loose and you're not able to get to a dentist, they do have adhesive products. They do have like many brands out there. The two that I chose on this slide is Fixident, which is just kind of like a cream. Pretty much with the creams, less is more. You know, you don't want it to ooze out. You don't want it to just like be all over the place. And it actually could possibly cause like irritation when you use too much of it. The other one that is on there is C-Bond. They're kind of like little strips. I noticed that a lot of people who use lower dentures choose this type of adhesive more than the creams. And then now we're going to move on to cleaning your denture. So as far as like cleaning your denture, the two main things that you need is just like a brush and a denture, you know, like some type of plastic container that can hold water. As far as like the Effordent tabs, those are just something that is by preference. You don't really need them. Some people do use them because it says it like kills bacteria and things, but the main purpose is just to brush the food and debris off of your denture and to store them in the container in clean water every night. So the next slide I'm going to show you is just someone who does not properly clean their denture. And basically the top one, which is just someone whose dentures haven't been clean. There was food and debris on it. Now it looks like it has hardened into like, you know, like calculus. So it's really important that, you know, you brush the food and debris off so they don't harden, and, you know, it just produces bacteria because it's kind of porous at the same time. So it's just really important for you to take them out every night, clean them, and store them properly. And the way that you do that is you just, you know, take them out, and you want to, they don't really recommend for you to use toothpaste anymore on it because it can be a little abrasive to the plastic and cause like little micro, like little scratches in your denture. So they say just like water and the brush is fine, or you can use like a Listerine or something if you want like freshening on it. And then the next slide I'm going to show you is just basically somebody who does not take out their denture every night and, you know, properly clean it, and, or just even let their tissues rest for the night. So it can cause some type of like bacterial or fungal infection on the roof of your mouth. This example is just somebody who you can see the outline of their denture. It just looks like it's really irritated, and, you know, some type of fungal or bacterial infections happening. And the last thing I wanted to mention is that a lot of people that wear dentures, they feel as if they don't need to see a dentist anymore. And it's just really important that you at least see your dentist at least every 6 months to a year, just to make sure your tissues are healthy if you're in a full denture, and to make sure you get like an oral cancer screening. All right, so that's all I have. If you have any questions, feel free to ask now.
Okay, and
Next up is going to be Carolina.
Just 1 second. There you go. Okay. One second. There you go. Got it. Okay. So, hello everyone. My name is Carolina and I'm going to talk about benefits of fluoride and condition called dry mouth. Okay. So what is fluoride? Fluoride is a naturally occurring mineral that plays a critical role in preventing tooth decay. It's been an essential oral health treatment for decades. Fluoride supports healthy tooth structure and fights the bacteria that harm teeth and gums. The next slide shows natural sources of fluoride. We can see that fluoride is found in drinking water, food like vegetables and grains, as well as other beverages. But I would like to point out one of the most important source of fluoride, which is drinking, or we call that tap water, because community water fluoridation benefits everyone with no cost. Simply by drinking water, we are receiving preventative treatment against cavities. However, along with fluoride found in the environment, other good dental habits such as flossing and brushing daily needs to be involved in our home care routine. And we want to make sure the products like toothpaste or mouth rinses contain fluoride as well. So there are some examples on this slide of these products, okay? So we have a toothpaste here and some different types of mouth rinses. Especially ACT is really recommended who has a high risk of cavities because it contains a really good amount of fluoride. Okay, also fluoride can be applied professionally by dentists or dental hygienists if you are in a higher risk to develop cavities. These products have a higher concentration of fluoride and fluoride varnish, which you can see it over here and right here. Fluoride varnish should be applied on your teeth at least twice a year, or you can have trays like this, which you put like gel in there or foam and keep it for a couple minutes, and it's done in dental offices as well. And of course, dentists, they can prescribe you toothpaste or mouth rinses, which contains a higher concentration of fluoride in case you need it for your daily routine and use it at home. Now we have this slide, and this picture shows the components that need to be present to develop the cavities. The tooth decay can develop in any age, and it's not just a problem for children. It can happen as long as you have your natural teeth, you eat your food, which has sugar in it. Then a sticky film bacteria, we call it plaque, builds up on teeth and produces acids that over the time eat away the tooth structure and creates a decay, which you can see it right here. So fluoride is highly recommended if you have A history of frequent cavities. What does it mean? It means if you have one cavity every year or every other year at least, you are in a high risk of cavities, to develop cavities. Then we have a gum disease, which means that the root of your tooth can be exposed, and the area where you can see it right here, if you can see my mouse over there, it's exposed, and it's can be, bacteria can accumulate there and can damage and can create the cavity over there. Then if you have crowns or bridges, these treatment can put these teeth at risk for decay at the point where the crown meets the underlying tooth structure. So you can see where the crown meets the gums. That area is very susceptible to develop cavities if we're not gonna remove the plaque or remove the food which left after we eat. And another one, very important condition, we call it dry mouth xerostomia, occurs when salivary glands don't make enough saliva to prevent the drying of the mouth. We all need saliva to moisten and cleanse our mouth and digest food. So the lack of saliva makes it harder for food particles to be washed away and acids to be neutralized. Saliva also prevents infection by controlling bacteria and fungi in the mouth. So what can cause dry mouth condition? If you're not drinking enough fluids, sleeping with your mouth open, if you're taking certain medications like for allergy, high blood pressure, pain, anxiety, or if you have a history of chemotherapy or radiotherapy, diseases like Sjogren's syndrome, diabetes, Parkinson's can increase the risk to have a dry mouth. And what can it cause? So what is the negative effects of xerostomia? So as I mentioned before, it's dryness or a feeling of stiffness in the mouth, a dry red tongue, bad breath, mouth sores, increased plaque, tooth decay, and gum disease. You can see cracked lips and difficulty speaking. So on this slide, we can see some products which can help to fight with the dry mouth. Of course, I want to mention that water and sipping on water, it's very, very important. Then we have mouth rinses containing fluoride, dry mouth lozenges, gums, gels, patches, and sprays. That was all. If you have any questions, you can email us. Thank you. I'm gonna stop sharing my screen if I can.
For the top.
Oh, your faces cover that. Okay.
Okay, Wilney is next. There we go. Wilney, you're mute.
Okay, sorry. My name is Wilney. I'm going to be talking about nutrition and talk about how it's important. So why is it important to maintain a good nutritional health? Well, maintaining overall good health is important because it prevents like someone from contracting any diseases from entering the body, especially in the oral cavity. So obviously the oral cavity is the mouth. So food enters into the mouth and it breaks down with massification, which is chewing with the teeth. And it uses natural enzymes, which is why it's important to maintain a good health. So good health starts from the inside of the body, like what we consume. So it's very important to eat a nutritious meal daily. Yeah. So how does nutrition affect the oral cavity? Well, nutrition affects the oral health because it depends on the types of food that is being consumed by the individual. What happens is we have something called tooth enamel. So what it does, it demineralizes and remineralizes throughout the day when we eat. So if we eat poor, we have a poor nutrition with foods that are high in carbohydrates, sugars, starches, it can cause acids that can damage that enamel and causing decay to the tooth, which is cavities, as known as cavities. It can also cause gum disease or periodontal disease. So periodontal disease is when the soft tissues and the bone is damaged because of a serious gum infection. And we can also get xerostomia, which is dry mouth. So these foods that actually can cause that is cookies, cake, soda, and other unhealthy foods. So as you can see here, in this first picture, this is a cavity. So this was damaged by probably sugar or something. And this is periodontal disease and gum disease. So what should you do to have a good oral health? Well, it's really important to have a balanced meal between veggies and grains. It can help with the overall health, but it will protect you from oral diseases. So most often it occurs in older citizens, so such as gum and periodontal disease. So at times it's okay to have some sweets. We all have cravings and we always want to have some sweets, but it's important to stay hydrated so it doesn't cause that dry mouth, because sugar causes the mouth to dry and it can cause decay. So I know a lot of older people, they like to have dessert with coffee, which is worse because it dries the mouth. So it's very important to drink some water. So as you can see here, lots of water is important, and we have the good guys and the bad guys. So the good guys are the good foods like fruits, vegetables, milk, yogurt, and then we have the bad guys, which is that candy, starchy foods, which can cause decay in periodontal and gum disease. So if you have any questions, you can ask.
Okay, so that's the end of our presentation for today, Chris.
Okay, so as I said, and I'm the program manager of the Elder Dental Program. It's a nonprofit, community-based program where income eligible elders have a match with a dentist that will provide services on a sliding scale fee. I'm going to scan down for the amount so you can see. See if I can turn my camera. Oh, maybe I can't. Oh, okay, we'll do it like this. So for a single person, it's just over $31,000 in annual income, and for savings, it's just over 25. For a couple, it's just over $43,000 in annual income, and for savings, just over 50. Anyone who's interested in more information, please give me a call at 774-203-1326. And I'd like to thank Regis College for participating in today's webinar about oral health.